mentioned this status where you are not diabetic, but you have a likelihood. You have a likelihood of developing diabetes. This is at the point where you have a fasting blood sugar of 6.1 to 6.9, okay, or a HbA1c between 5.7 and 6.4. That tells us that you are not yet diabetic, but you have a likelihood of developing diabetes. There are no symptoms at all, but in this case, please make sure that you regularly screen for type 2 diabetes every year, and do changes on the lifestyle. Okay, on the lifestyle. Now, this is again where the normal HbA1c should lie, 5.6 and below. Between 5.6 and 6.4, there is a problem. You need to work out. You need to prevent progression to 6.5 and above. Now, how then do we prevent type 2 diabetes from a pre-diabetic status? Okay, so early treatment and lifestyle changes can return blood glucose to normal. Okay, now how do we do the lifestyle changes? Well, it has been noted that type 2 diabetes likelihood can be lowered when one loses 5 to 10% of their body weight. Just take your BMI, just take your body mass index below 25. Okay, from here, like, so just have to have your BMI between 18.5 and 24.9. This is a situation that can give us a pre-diabetic status. This is a situation that can give us a diabetic status. Okay, so by losing 5 to 10% of the body weight, by that, when your blood tests are at pre-diabetic state, then losing body weight can take us down to normal. Okay, now appropriate dietary plan to avoid high intake of refined carbohydrates. Okay, carbohydrates that do not have any vitamins, they are not fortified, and they are direct carbohydrates only, or processed food, the chips and the sausages and all that. Okay, now these are the things that you need to avoid if you are pre-diabetic, to prevent yourself from progressing to diabetes. Okay, now, and these are the things that you can befriend and take them. Okay, now exercise moderately, 5 days a week for at least 30 minutes per day. Get a brisk walk, or just to exercise to burn the calories and move out the glucose from the bloodstreams to the body cells for energy. Okay, now I want us to look at hyperglycemia and hypoglycemia. Hyperglycemia is usually a tendency whereby the sugars are higher than normal. Okay, and hypoglycemia, I'm talking to now a situation whereby you could be having diabetes, and you occasionally find sugars being high and sugars being low. Okay, now hyperglycemia is an excess